Today, I want to talk with you about nasal congestion, stuffiness, facial pressure. Why is it happening, and what can we do for you? So what are those three things that can cause those similar symptoms of stuffiness, pressure, congestion? I call it AAA: allergy, atypical migraine, and anatomy. So how do we figure out what is it that's bothering the individual and causing their problems? Well, all three of those can cause similar symptoms, but there are definitely some specific symptoms specific to each condition. Allergies can cause sneezing, itchy, watery eyes. Allergies themselves don't cause yellow or green drainage, and they don't cause headaches. Atypical migraine can certainly cause stuffiness, but it's also going to cause dizziness, and also it can cause pressure and pain on the side and the back of the head where there are no sinuses. And finally, when people have a real sinus problem, usually they're going to talk about having persistent, frequent, yellow, green, yucky drainage and cough. So how do we figure out what's bothering the person and why it's happening? Well, more often than not, just by listening to the patient and hearing their story, we'll know, is it migraine and or is it allergy and or is it a sinus problem due to their anatomy. And once we listen to the person and get a good idea of what's going on, then it comes time for the examination. And a big key to trying to help people who may have migraine is knowing that there are specific points on our skull where people will be tender where they have migraine. There's a nerve right here, a nerve here, and a nerve in the back of our head right there. When people don't have migraine, you can push all day in these spots, and they'll be like, when are you going to get off? If somebody has migraine, when you push on those spots, they'll be like, whoa, get off, please, right now. And that's a great way to know, does somebody have migraine or not? How to tell if somebody has a true sinus problem? Well, that's going to require a good examination with what's called a nasal endoscope, where we take a telescope and look inside the individual's nose, and by knowing one's anatomy, we can tell, is there an obstruction of the pathway to the sinuses that's preventing the proper ventilation and drainage of the sinuses. Most people, when they have sinus problems, it's due to an obstruction of that pathway that's preventing the proper ventilation and drainage, and the mucus is just staying within the sinuses and getting infected. Once we have a good idea whether an individual may be experiencing a true sinus problem or a migraine syndrome, then we'll usually get into getting x-ray studies. If one's suspected of having a migraine syndrome, then we'll usually get an MRI of the brain. If somebody's suspected of having a true sinus problem, then we'll usually get a CAT scan of their sinuses. So what do we do once we figure out, does somebody have an allergy problem or a sinus problem or a migraine? When it comes to allergies, allergies are a chronic condition that we just ain't going to cure. And the key is find a regimen that works, and then once you do, you stick with it. Does one have to stick with it every single day of the year? Depends on whether one's a seasonal versus a year-long allergy sufferer. When it comes to migraine, if one had to be a migraine sufferer, this is a great time in the history of the world because there is so much that we can do to help people with migraine such that it becomes a very minimal part of their life, and our treatment these days greatly improves the quality of individuals' lives who suffer with migraine. If somebody has a true sinus problem, very often that's going to require surgery because usually that's due to an anatomy problem that is preventing the ventilation and drainage pathway from being open, which is leading to the person having the recurrent infections. Many people suffer from nasal congestion, stuffiness, pressure for years and years without getting a proper diagnosis and certainly without getting proper treatment. If you're having any of those symptoms, please give us a call at Weiss ENT. We will make sure that we get you properly diagnosed and on the right path to feeling better.